quickly move on to the next scenario, and it's going to be a new chapter. It's going to be respiratory system, and I will quickly read the scenario number 6 for you all. Thank you, Miss A, for reading those first 5 scenarios. They were long scenarios, and if did a great job. Thank you, Miss If. So let me read this case scenario number 6. What CPT and ICD codes 10 CM codes are reported? Your options are option A 32669 C34.11. All the ICD codes are same. Option B 32662 C34.11. Option C 32663 C34.11. Option D 32666 C34.11. Preoperative diagnosis mass right upper lobe. Postoperative diagnosis carcinoma right upper lobe. Procedure performed VATS, which is video assisted thoracoscopic surgery of right superior lobectomy under general anesthesia, a double lumen tube intubation, right lung vascular lapse, and right side up is oriented. So the patient is in the left lateral decubitus position. We prepped and draped the patient in usual sterile manner and gave antibiotics. Then 1 centimeter incision were made along the posterior and mid-axillary line at the 9th and the 7th intercostal space. The lung was deflated and a camera was inserted. A longer 6 centimeter incision was made along the 4th intercostal space anteriorly. We then freed up some adhesions at the top of the lung, both the superior and the superior area away from the tumor, and in the anterior mediastinal area the tumor seemed to be in the right upper lobe. The dissection began by ligating the superior pulmonary vein and its branches, and the upper lobe was freed up. Small fissures was incomplete, and I proceeded with the lobectomy. The pulmonary artery branches were then ligated. Bronchus was ligated as well. Superior branches to the upper lobe were ligated with endo-GIA. Lobe were free up and sent to the pathology. Wound was closed in layers. The chest tubes were placed to suction, and the patient was sent to the recovery in a stable condition. Pathology confirmed carcinoma. What CPT and ICD codes are reported for this scenario? Coders, you have 2.5 minutes, and your time starts now. Okay, coders, that is time. So I will pick up the pace now because we have few more scenarios to cover. Please feel free to take the screenshot if you haven't completed, or if you feel like you have to work on this later. So you're free to do that. So let me start by highlighting the keywords. So this is one of the example which I said go with the post-operative diagnosis. You can now see the why I said so. Pre-operative diagnosis, it was just a mass of right upper lobe, and post-operative diagnosis, it was confirmed that this is going to be a carcinoma of right upper lobe. The procedure performed is VATS, right superior lobectomy. General anesthesia was given. 1 centimeter incision was performed posterior and mid-axillary, ninth and 7th intercostal space. Lung was deflated and a camera was inserted. Dissection began and left upper lobe was freed. Small fissure was, was incomplete, and I proceeded with lobectomy. Superior branches of the upper lobe were ligated with endo-GIA. Pathology confirmed carcinoma. So yes. So great answers in the chat, coders. Keep them coming. So we have in procedure inventory VAT as right superior lobectomy. So this is a video assisted thoracoscopic surgery. You also read somewhere in the procedure note that the camera was also inserted. So this is a video assisted right thoracoscopic surgery. Diagnosis inventory, we have a carcinoma of right upper lobe, and this is the anatomy of lung. You can see left lung has 2 lobes, and right lung has 3 lobes. So exactly as mentioned in our scenario, there is a mass in a upper lobe, right? Yes, it is present in the right upper lobe in the scenario as well, and the doctor has performed a lobectomy procedure. So that means the entire upper lobe was removed, not just the mass, the entire right upper lobe was removed. And in the options, and yes, this is another image which is showing a video assisted thoracoscopic surgery. So there are multiple incisions which are placed, and definitely through one of them camera is inserted, with the help of which the procedure is completed. So with that said, option D is coding for a thoracoscopy with therapeutic wedge resections of initial or unilateral. Cross-checking with our procedure inventory, we had lobectomy and not wedge resection. That means option D is incorrect. And now let's look at option A, that is for 32669, which is for a thoracoscopy with therapeutic wedge resection. Sorry, which is for a thoracoscopy with removal of single lung segment or segmentectomy. It was lobectomy performed here, so option A is also incorrect. That's not matching with our procedure inventory. Left with option B and C. Option B is coding for 32622, which is thoracoscopy with excision of mediastinal cyst or tumor or mass. So as I said, it's a lobectomy. Entire lobe has been removed and not just the tumor or mass. So option B is also incorrect, and the correct answer is going to be option C, 32663. That is coding for thoracoscopy with lobectomy single lobe. So great work, coders, on that scenario. Please let me know in the chat that if you have any questions. I can see everyone has come up with only one answer here. So let me know in the chat if you need any help with this scenario. Meanwhile, I will quickly move on to the next scenario. This one is going to be a short one, and I'm sure you're going to answer it quickly, maybe before I complete the question as well. So I can see that happening also. So good work, coders. So what are the CPT and ICD codes reported for the scenario? Option A 31603 C32.0, option B 31601 C32.0, option C 31600 C32.0, option D 31601 C32.0. Preoperative diagnosis: a malignant neoplasm glottis Postoperative diagnosis, malignant neoplasm glottis. Indication, 38-year-old patient here for tracheostomy with malignant neoplasm glottis and difficult in breathing. Procedure, incision is made low in the neck. Trachea is identified in the middle, and an opening is created to allow for the new breathing passage. Tracheostomy tube was inserted and secured with sutures. Patient tolerated the procedure well and sent to recovery without complication. What are the CPT and ICD codes reported? And coders, I'm sure you're going to answer fast. Still, I will give you around 2.5 minutes to answer this scenario. Okay, coders, at each time. So as I said, I will pick up the pace. We have got some more times left, some more minutes left here for the first session. Please let your answers, please place your answers in the chat, and you can also take the screenshot of the question if you feel like you need more time. So here we have a malignant neoplasm of the glottis. Incision was made in lower neck. Tracheostomy tube is inserted and secured, and that's all what we have. So this is a small question, this is straightforward question. I always give an extra attention, or I will be more careful actually while answering the shorter questions, because sometimes we might feel like this is going to be easy, so easy, after doing long scenarios, and we might end up making silly mistakes, uh, and yes, they are easily scoreable. So you have to be forensic, I would say forensic, while answering these small scenarios. They might be tricky one, so always be forensic. Once you see the small scenario, don't spend too much time, but be a little bit forensic while going through the scenario. And yes, so we have highlighted the keywords. In procedure inventory, we have a tracheostomy, and in the diagnosis inventory, we have malignant neoplasm of the glottis. So that's all we have. Now let's start process of elimination. Option D is wrong. That is coding for 31601, which is for tracheostomy planned younger than 2 years. So what's the age of the patient? It's 38-year-old patient in the scenario, so it's not younger than 2 years, which means option D is incorrect. And option A, coding for 31603, is incorrect because that's coding for an emergency tracheostomy procedure, transtracheal. So was this procedure an emergency or a planned procedure? This was not an emergency procedure, right? Yes, this was not an emergency procedure. Patient had a malignant neoplasm of the glottis and it was a planned one. So option A is also incorrect and option B is wrong because that is coding for tracheostomy, fenestration procedure with skin flaps. So we didn't have any fenestration procedure as well here. So option B is incorrect and last option left is option C, which is coding for 31600, which is tracheostomy planned procedure, and C32.0, which is coding for a malignant neoplasm of the glottis. So how are you feeling, coders? I know there is going to be an aha moment for this one. Great, great. So, okay, so I think we have got a time for one more scenario here. So, okay, I will give you a challenging scenario. So let me finish this one. So it's going to be the last scenario for the class. And I thought like, let's make this one a bonus question if I got enough time. But this is a good scenario. So I thought like, yes, you should practice this one. So this is the question, coders. What is the correct code selection? Your options are option A, 12031, 1201359 modifier, S01.21XA, S61.419A, and W23.21.03. So all the diagnoses are same. So I will just read the CPT. Option B, 12041, 1201159 modifier. Option C, 12013 59 modifier 12041. Option D, 12041 59 modifier 12013. A 25-year-old woman presents to the emergency department with a laceration to her face, hand, and nose. The patient reports that she was hit with a baseball, and the physician performs simple repair of the laceration of 2.6 centimeter of the face, 1.3 centimeter on the nose, and 1.5 centimeter intermediate repair on the hand. What is the correct code selection for this scenario? So coders, your time starts now. All the best. Okay, coded scale. So great answers. This was a good scenario. So let's review them. Okay. Yep. So we have a laceration on the face, hand, and nose, 2.6 centimeter of laceration on face, 1.3 centimeter on the nose, and 1.5 centimeter intermediate repair on the hand. The correct answer is going to be option D. Please feel free to take a screenshot. I will just hold the screen for a few seconds. Okay, now I will just move on. And yes, these are the FTRs. Repair type simple intermediate complex. Add the closures of the same complexity and body area. Code according to the size of the repair. Sequence the most complex repair first. And this is my procedure inventory. So doing laceration repairs, always get your procedure inventories correct, write it down, and that will help you code easily and quickly without confusion. So option A, coding for 1912031. This one is incorrect because it is coding for repair intermediate wounds, scalp, axilla, and or extremities, and those parenthetical notes is very important. This is excluding hand and feet, and we had an intermediate repair of hand. So 12031 is not correct code because that is coding for those extremities, which is excluding hand and feet. So which means option A is incorrect. Now let's move on to option D, which is coding for 12041. That is a good code selection. It's coding for a repair intermediate wound, neck, hand, feet, or external genitalia, 2.5 centimeter or less. Yes, this is a good code. So it's also matching our procedure inventory of intermediate repair of hand of 1.5 centimeter. But the second code in option B, 12011, is incorrect because that is coding for simple repair of superficial wounds of face, ears, uh, eyelids, nose, and mucous membrane 2.5 centimeter or less, because we are having a repair perform more than 2.5 centimeter. Why? As for the FTR, add the closures of same complexity and body area. So we had a simple repair, which is of same complexity, and the body areas are of face and nose. So we have to add these 2 centimeters. So adding them, 2.6 plus 1.3 gives you 3.9 centimeter, and 12011 is only coding for the simple repair of these mentioned locations of 2.5 centimeter or less. So that doesn't satisfy our the length of the laceration repair performs. Option C is incorrect. The correct answer is going to be 12013, which is for simple repair of superficial wounds of face, ears, eyelids, nose, lips, or mucous membrane, 2.6 centimeter to 5.6 centimeter. Yes, that falls between falls like 3.9 centimeter falls between 2.6 and 5 centimeter. So that is a correct code selection. Now only difference between option C and option D is in their sequencing order. Codes options are same, only sequencing order are different. And as per our FDR point number 4, it says that sequence the most complex repair first. So is a simple repair more complex or an intermediate repair complex? Okay, I was just waiting for yes. Intermediate repair is more complex than the simple. So that's why the intermediate complex repair should be, intermediate repair should be sequence first, followed by a simple repair. So with that said, option C is incorrect. And option D is going to be the correct answer, which is coding for 12041, 12013, 59 modifier, S01.21XA, S69.49, AW1 21.03. So how are you feeling about this question, Goddess?